Hello everyone, my name is Megha Prasad and I'm here at AHA 2016. I'm joined by Dr. Steve Nissen, who will be talking to us a little bit about his precision trial. Thank you so much for joining us, Dr. Nissen.
It's my pleasure.
So tell us a little bit about the rationale and design of the precision trial.
Well, this was a trial designed after the withdrawal of rofecoxib from the market now a number of years ago, more than a decade ago. It was a very controversial period. The COX-2 inhibitors were under a cloud of suspicion after Vioxx was withdrawn. The FDA allowed one of these drugs, celecoxib, to stay on the market, but mandated a large safety trial. It has taken us a very long time, but we now have the results of that trial. It's a 24,000 patient study. It started, first patient enrolled in October of 2006, 10 years ago. And the design was to compare celecoxib to ibuprofen or naproxen, and the endpoint was a non-inferiority assessment for the endpoint of cardiovascular death, including hemorrhagic death, MI, and stroke.
That's great, and you're going to share the results of the trial with us.
Well, the results were surprising to everybody, including me. We thought that celecoxib might be riskier than ibuprofen or naproxen, and it turned out that it wasn't. The actual event rates with celecoxib were a little bit lower, not statistically significant, but the non-inferiority analysis had a p-value of less than 0.001 for non-inferiority. I think we demonstrated without any doubt that celecoxib is not worse than ibuprofen or naproxen with respect to cardiovascular outcome.
So how do you think this is going to change our practice in the next 5 to 10 years? Do you think we will be using more celecoxib due to the results of your trial?
Well, I try when I do a clinical trial not to be the source of advice. I'm going to let others interpret it. I will say that some of the secondary and tertiary endpoints of our study do show safety differences between these drugs. There were a lot more gastrointestinal events with ibuprofen and naproxen than there were with celecoxib. And there was a particularly striking excess of renal events with ibuprofen compared with celecoxib. So I think people have to look at the global safety of these drugs as they make choices. I think the good news for patients is that we have another opportunity to rethink this whole question of safety with NSAIDs, and the results are perhaps a bit surprising.
Lastly, any advice that you have for fellows that are interested in getting involved in clinical trials? How should they get started?
Well, for a fellow, if you're going to spend 10 years of your life doing a clinical trial, it ought to be a good one. It's a long, long, long commitment.
That surely sounds like it, and you've devoted your life to some really great clinical trials. Last question. So in New Orleans, any favorite spots that you've been to, or have you been too busy with the meeting?
When I go to these meetings, I don't get to have any fun. When I was a fellow, I'd come to these meetings, and I'd spend a lot of time on Bourbon Street doing things that I wouldn't do at my age. But I hope that the fellows who are listening are enjoying their youth, because it doesn't last forever.
Well, great. Thank you so much for joining us, Dr. Nissen. We appreciate you being on the show. For more videos like this, please go to www.youtube.com/fitsonthego.